We're also joined by Dr. Dev Patel. It's lovely to have you with us, Dev. And this is the reason, because it's a brand new day, the sun is out, hottest day of the year so far. Have a look at this, 26 degrees in London, 21 in Manchester, Glasgow and Belfast. Don't get me wrong, sunny weather always puts me in a good mood. Look at that. And it's not even the middle of April yet. But in the early sun of the year, we can forget to protect ourselves. Even April sun can do damage. Dr. Dev is with us, a skin specialist. Is this the time of year, Dev? Lovely to have you.
Thank you.
Is this the time of year where people get caught out? Is that what you see?
Yeah, you know, when the sun suddenly comes out like this, I think our nation goes mad, doesn't it? I mean, half the blokes in Portsmouth are already out with their tops
That's your
off.
hometown.
It is indeed. And usually with a beer in the hand. But you know, we do go mad and we don't think about the risks and dangers. And it's not just about skin cancer, of course. It's just about skin health. And we do need to think about protection, and sunscreen is fundamental to
Okay,
that.
let's go through the basics, through the fundamentals. What does it do? Why is it so important?
It's about protecting us against UV radiation. So the main ones, it's UVA, UVB, they're the ones that hit our skin. And UVA contributes to age-related damage, so collagen breakdown, pigmentation, and you know, more superficial damage, but it does also contribute to skin cancer risk. And then there's UVB, which is going to be, you know, more responsible for burning when you get sunburn, but it also causes direct damage to the DNA in your cells. And of course, that can be a big driver towards, you know, increasing your risk of skin cancer.
And understanding the difference between those two, and
Yeah.
the damage that they can do, is crucial when you're trying to protect yourself, right?
Yeah, absolutely, and just being aware of both of them, but they you know, they are so important because UVA, for example, is present all year round. UVB is higher in the summer months, but knowing what they do to your skin will also help influence or help you decide which product is going to be right for you.
So very, very crudely, UVA for age, A for age, and B for burn?
Absolutely.
That sounds about right.
Yeah.
That's something I've learned today. What's your protocol? What's your regime, Paula?
So
Christo?
I have always used suntan lotion, much as I was mocked by my friends of colour when I was younger. It just seemed obvious that, of course, yes, I may have darker skin, but I can still burn, right?
Yeah, and now they're probably looking a little bit more damaged than you are, and not as young as you look. So, you know, but it's not just about vanity, of course, because, you know, we know that skin health is directly tied to your internal health. And it's not about, you know, just when you're in your 40s, 50s, whatever, because, you know, when I was serving in the Navy, I remember this Royal Marine who came into our dermatology clinic, and at 19, we diagnosed him with melanoma. And my consultant said to me, he won't be around in a few months' time because it was really far gone. So really, at all ages, we need to be thinking about this. In fact, one episode of sunburn in childhood doubles your melanoma risk. Wow. One episode.
So get it right early on, and that's
Absolutely.
something for parents as well. Okay, bearing that in mind, when should I be wearing sunscreen? Is it too early at the moment? Is that even a thing, or should I be wearing it in December?
So if we want to follow a more pragmatic approach, that you know, bodies like the British Association of Dermatologists say if the UV index is above 3, you should be wearing it. So today I know it's over 4. You know, many people in the industry, my industry included, would actually be proponents of saying all year round, if you're not in the pitch dark, you are by default getting some UV radiation on you. And so therefore you should be wearing some level of protection, right, especially if you're concerned with signs of aging.
We've got a few lined up here. You can spend anything on sun cream, can't you? And even makeup has it built in, has SPF built in as well.
Yeah.
Does the amount of money you spend make a big difference to how much protection you're getting from UVA and UVB?
More often than not, no, not necessarily. I've seen some very good products, you know, below £10, £15, and I've seen some products in the 50, 60 range which actually aren't much better. For me, talking generically, it's not just about the protection that you're getting from the sun, but actually what else is in that formulation and how skin friendly is it, particularly if people have got sensitive skin or you're applying it to children, etc.
It's fascinating, isn't it? Can you talk us through what we find on these bottles? Because they are, I used to think that 50, 30, 20, that meant the amount of time you could spend extra, a multiple of how long you could spend in the sun. Is that any truth in that?
This is the common misconception. So we do get told with SPF testing, for a start, SPF number only applies to UVB.
So that's the burn.
Yeah.
So that is telling you how much longer you could spend before you get burned.
Yeah, in theory, if you apply the same amount that they use in testing, that would protect you 50 times longer than if you didn't put anything on before you go red. And then the 30, I think there was a 30 here, this would be 30 times longer. So that sounds in principle like a big difference. But actually the reality is there's what we call a logarithmic curve relationship. So in simple terms, once you go above 15, so up to 15, it makes a big difference. But a factor 15 gives you approximately 93% protection against UVB. Okay. So you're only going to 96 roughly percent at 30, and a factor 50 gives you about 98. So there's very little increase. But what happens is people who are putting a 50 on actually can get quite complacent.
Oh, really?
Yeah.
So just to clarify that then, so if you're using a 15 and you said it's about the time that you're in the sun, so presumably if you then just reapply it more often than you would wearing a 50, you will be nearly as protected.
Absolutely. If everything else in the formula is the same, exactly. And you know, the one I use in clinic, which, because for me, frankly, whether I've got a patient with rosacea or I've got someone who says my skin's got no problem, I still want to give them a barrier-friendly formula. I only sell a 25, but I've got loads of patients who say this is far superior to any 50 I've tried.
Right, okay, so that's UVB,
correct,
is the SPF, right? How do I know about UVA if I'm worried about aging?
Absolutely, well, that's a bit more difficult because Boots, I think, started the star system.
So and that's what we've got, just one of these tiny little one there. I don't know if you can see
that's out of 5, and so that's 5 stars.
So that's got 5 stars out of 5 UVA protection.
Correct, yeah.
That's
so that's a good broad spectrum as far as the label is concerned. Then one of these, I think, this one's got 4 on the back, which is still pretty good, but in theory not as good as that one.
Okay, this one says it's for kids. Any difference at all in that formulation?
So one would hope that the formulators have paid a bit more attention to how barrier friendly it is. What a lot of sunscreens have, and sadly I've even seen it in children's products, not necessarily this one, is that they use things like denatured alcohol, which is often very high up on the list, which just dries the barrier, irritates the barrier. And fragrance, I see, and it's not just perfume or fragrance, it will often be fragrance allergens, which people need to know what they are to identify them. Most sunscreens have a cocktail of fragrance in there. The only reason they're putting in there is to sell more product because it appeals to your senses.
You don't need
It's actually not friendly to your skin barrier.
And that's the sort of thing you only find out when it's wrong.
Yeah.
Yeah, you'd only know that if it goes badly.
Well, can I just deal with a controversy on that point, particularly about children? Because I've got 3. One of my children suffers terribly with sun-related eczema. I have tried a myriad of suntan lotions that tell you that they're skin friendly, that tell you that they're eczema friendly. And so I get when we see online some parents who say, no, I don't put any suntan lotion on my children. And you'll have seen those controversies, right?
Yeah.
Like, help us.
Yeah. So what's happening is obviously if someone, in this case, eczema, dermatitis, the skin is already inflamed, the barrier's already breached, your defense has gone. So any inactive ingredient in the formula that's potentially irritant to skin has just got an easy path in. So your child's skin's got no hope there.
Right.
So I'm not going to do any brand mentioning here, but I've got something backstage and I'll let you have it, and it's almost certainly going to be okay for your child.
Right. A very quick one. Can I use it past a sell by date? Is it just less effective or is it going to do me harm?
It's almost certainly not going to do you any harm, and it's probably going to be okay for a while. Some ingredients can obviously over time break down. But the dates are just in line with how long the stability testing has been done. So it's not necessarily a marker of it actually having gone off.
Okay, brilliant. Some myth busting. Midday myth busting now in the sunshine. Here we go. First one. Do you need to wear sunscreen, suntan lotion, on a cloudy day?
Yes, because you've still got UVA coming through, if nothing else.
That's a very
I use a
answer.
daily moisturiser that has UVA and UVB in it.
Because you're worth it, Christo. That's what I'm going to say.
That's all.
Does wearing higher SPF sun cream mean less frequent applications? Kind of dealt with this a little bit.
Yeah, no, because most are chemical based, and chemical filters break down within minutes.
Okay.
So an hour or two and you should be reapplying.
Oh, okay. Will SPF in makeup protect your skin? Loads of them advertise it.
Absolutely not. So the testing is done with, say, in a powder, you'd need to apply 20 times more powder than the average woman would to get the actual SPF
So
protection.
it's not either or then, it's you've got to have the
That's why I
sunscreen as
insist
well.
on so much makeup.
Yes, and a full beard. Will having a base tan stop you from burning?
Oh, a tan means your skin's already been overwhelmed. That's a temporary build-up of pigment to help
No
defend
such thing as a
yourself.
good tan.
So not really. It might, but I don't want people to think that
Very
way.
quickly, give me the 3 big ideas that people can leave with as they go out into the sun today.
Yeah, okay, so just apply every 1 to 2 hours. Make sure you apply 30 minutes before you go in the sun so you're already protected. And SPF number is not everything.
Yeah, okay, that's so good. Thank you so much. There they are. SPF isn't everything. Half an hour before you get exposed and reapply regularly. That's what you need to know before you go out in the sunshine today. Thank you so much, Dev. That was brilliant.